I, Michael Cordery, on this day, the 24th of August, agree to the inclusion of my contribution in this DVD video assessment, the nature of which has been explained to me. I understand that my contribution will be viewed by an assessor at the college for the purpose of assessment and marking. I am over the age of 18 and have agreed to be part of this DVD video assessment as a voluntary basis. I understand that this DVD video assessment, or part of it, will also be used for the purpose of further review at the college or used in moderation for validation purposes. I understand and agree that my personal details of this DVD video assessment will be stored and archived in accordance with the college policy and procedure. I have read and understood the college privacy policy and procedure found at www.think.edu.au/policies and forms. My contribution has, to the best of my knowledge, been truthful and honest. I have not deliberately sought to conceal any relevant facts from the markers of this DVD video or assessment reviewers.
Hi Michael, my name's Stephanie, I'm your therapist today.
Hi.
Hi. So what have you come to see me for today?
My shoulder, it's a bit tight and things. I play a bit of sport and particularly tennis sort of fairly regularly, and it's just sort of noticed it's been a bit tight and things, and over the last probably couple of weeks haven't really been able to sleep on it. I try and lie on my right side and it gets pretty painful. So.
Okay, alright. When did it all sort of start?
The pain really only sort of started fairly recently. The only thing I can really think of, I still do a bit of running and stuff, and I fell over running in the wet probably a few months ago, and you sort of fell down on my elbow and sort of, I don't know, maybe it like jarred it or something. I don't really know exactly what happened. It hurt at the time, but, just one of those things, you fall over, you get back up and keep on going sort of thing. But I can't think of anything else that I've done that really would have caused any injury.
Okay, so originally the pain was in your elbow
and my shoulder.
And your shoulder, and now it's just both. In your shoulder?
More so, like not, as I'm sitting down here, it's fine. It's only sort of when I start playing a bit of sport and sort of moving it around that, or if I put sort of pressure on it, I guess when I'm sort of laying down on that side, it pushes it one way or the other or something. I don't know.
Yeah. Alrighty. And you didn't see a GP or a physio or anything like that?
I just thought, it's one of those things.
Yeah.
It'll be alright.
Okay, alright. I've got an old X-ray of yours that your GP sent over.
Yeah.
Shows just a little bit of osteoarthritis in that shoulder joint.
Yeah.
I wouldn't expect that would cause that amount of discomfort. It can contribute some discomfort, but it would probably be more constant if it was caused by the osteo. So it sounds to me like you might have done something to your rotator cuff ligaments, especially, when does it hurt when you're playing tennis, when you're doing your swinging, or?
Yeah, basically it was sort of whenever like lifting up.
Sort of, yeah. Yep, so you're finding it hard to do your serving?
Yeah,
hard to get your shoulder up?
I sort of need it. Sort of the major part of tennis, so I can't really do. I sort of need it for everything.
Okay, no worries. And how often would you play tennis?
I used to be sort of. I haven't played for probably a week now, but sort of I used to play weekly basically. Yeah.
Okay. Alrighty. And so you're obviously fairly keen on your sports.
Yeah, I try to keep pretty active and fit. I don't really like going to gyms and stuff, so sport's an easy way to keep fit.
Yeah, definitely. So you're fairly committed to trying to sort of get this fixed, I take it, so that you can keep playing tennis?
Pretty much.
Alright, excellent. I'm just going to ask you a couple of sort of lifestyle questions just to gauge your healing. Diet?
I guess it's good.
Yeah? Like fruits, veggies?
Yeah, all the usual sort of stuff.
Okay.
Take away very occasionally, not too much.
Yep. Okay. How long does it normally take you to recover from an illness or an injury?
Oh, I don't usually.
You don't normally get injured?
Not that often, no. Like, I don't know, usually probably just sort of a week or two. Sort of, depends on. I've never had anything real serious until, I don't know if this is serious or what, but I've never really had anything that stops me from doing anything for more than probably 2 weeks.
Okay, no problem. So with the pain in your shoulder, Is there anything that makes it feel better? Have you tried a heat pack or ice or anything like that on it?
Not really, just sort of
No.
trying to rest.
Rest it,
with
yeah. So it's fine when you rest.
Yeah,
It's
when I
mainly
sort of-
just when it's
Yeah,
active.
just when it's moving. Yeah.
Okay, not a problem. Do you take any painkillers or ibuprofen for it?
I have taken a bit, yeah.
Yeah. Okay. Alrighty. And is that just to get you through your tennis
Pretty
game?
much, yeah.
Okay.
I didn't play last week, but sort of week before us, yeah.
Yep. Sure. Not a problem. Okay, that's not a problem. So it seems like you're a fairly quick healer if you are able to injure
Yeah,
yourself
yeah.
in the first place.
Yeah, I guess I do. Yeah.
Yep, okay, not a problem. Alright, well by the sounds of it, we can go ahead with a massage treatment. It doesn't sound like it's an acute injury if it's happened a couple of months ago. You could have a bit of inflammation. Things that we have to look for that would stop us from treating it with massage is a fair amount of inflammation. Means that there's something going wrong there.
Yeah.
Cancer, obviously. Any sort of heart problems. Don't have anything like that. Your screening questionnaire looked all pretty safe, so that's all good. Okay, so what we'll need to do first of all is do some testing on your shoulder just to find out exactly where. I'll feel around the shoulder joint and I'll need you to tell me when it's sore, okay, if there's anything in particular that's more sore than other areas. We'll just do your basic range of motion tests and also some resistive testing, and we'll compare your two arms to see how different they are, because your left arm we'll use as the normal, what's normal for you, and then we can compare it with your right arm.
I'm right-handed, I don't know whether that makes any difference.
You're right-handed. Basically, we'll just mean that you use your right arm more. So your left arm might be a little bit weaker. So then if your right arm is weaker still, then we know that there's a fair amount of something going on in there. And then what we can do is we'll treat the shoulder essentially. So if it's fairly localized in your shoulder, we'll just treat your back, the back of your shoulder, around down your arm. I also like to just do some work on your forearm as well, because if your forearm is tight, that can have an impact on your elbow, which then impacts the way you move your shoulder. And then also the front, so your pecs and down the front of your shoulder there too. So we'll be using a couple of different techniques. We'll probably use a bit of trigger pointing, some myofascial release to try and stretch the fascia out so that your muscles have a chance to heal a bit better. And of course, as long as there's no inflammation, we'll use deep tissue, okay? Because what can happen is when you tear or strain your muscles and it's trying to heal, scar tissue forms. And scar tissue means that essentially you're not going to be able to move that muscle as well because it's quite thick. So we use deep friction to try and break that down a bit and rebuild new muscle and have it aligned properly. So then you can start moving it more comfortably. Okay, and is there anything else that's going on at the moment, health-wise, for you?
I've got a bit of a cold or flu or something that sort of seems to be hanging around for a little bit longer than what I'd like it to.
Yeah, okay, alright. That's not a problem. Massage can sometimes intensify colds, but it also tends to make them shorter. So it's kind of like having a cold in a really short, severe time frame. But if you're on the tail end of it, this might actually help get rid of it, as long as you're prepared to feel worse afterwards.
I've noticed that it's sort of, I don't usually get that sort of sick or anything. It's just sort of, it's not like bad, it's just sort of just the sort of head cold sort of thing occasionally.
Okay. Alright, well let me know at any time if you need a tissue.
Okay.
I've got plenty.
Will do.
Okay. Do you have any questions at all about the treatment plan?
No. All sounds pretty good.
That sounds good. Okay. I'll get you to take your jumper and your shirt off and then we can start with the testing.